About half of my patients start treatment on medication, and the other half often ask me about when medication is appropriate or applicable. I'm happy to say that I have tremendous faith in the power of behavior therapy and its ability to modify brain chemistry and recondition the brain's association mechanisms neurologically. So there's a term called neuroplasticity, meaning the ability to modify the brain's biochemistry. And I'm happy to say in 30 years of practice, when patients are very compliant with treatment protocol, I've seen people's brains completely being modified such that they no longer have OCD. They no longer qualify for the diagnosis in any way. To me, patients sometimes come into treatment completely overwhelmed by the emotional component. They're rendered in a way helpless, and they're just so fixated on their desperation, and they're so handicapped by the emotional component that in about a month or two of treatment and seeing that their progress in treatment is not sufficient, I might recommend one of the common SSRIs for treatment to combine with behavior therapy. When a patient comes in not on medication and asks about it, my most common response is to say, hey, let's give aggressive behavior therapy 2 months. Let's take a look at how effectively you're managing your treatment, how aggressively and how disciplined you are in the treatment process, and then just reassign or reassess whether medication is warranted. When patients come in on medication, I often encourage them to make no changes pharmacologically, to just stay exactly where they are. Therefore, we can more accurately assess if changes occur because of behavior therapy and make attributions as to, with those changes, that they were probably produced by the patient's new skills relationship with managing their condition. And I'm happy to say that the majority of successful patients that I work with either drastically reduce their medication or often will go off medication entirely, then go through what's a common, what I call emotional gauntlet, because these SSRIs often come with a withdrawal effect that can be very unsettling and very powerful and very deceptive, because these withdrawal effects can take place up to 2 months after a person has even taken their last pill. And it's very common that when people go through this emotional gauntlet of withdrawal, that they make a false attribution of, oh, this is what my life's going to be like without medication. And so they quickly go back on the medicine in order to reestablish equilibrium. And I'll encourage them to bear with their brain and biology to allow them to go through this gauntlet, as it were. It usually lasts around 2 weeks of really distressful experiences, because the medication leaving the body can produce some very unpleasant symptoms. And tragically, many patients are never warned of this by the psychiatrist, that they can look forward to this very distressing withdrawal. And so they make that attributional error to think that this is life without medicine versus this is how difficult it is to come off of these medications.